Pots and pans. PANDAS was a relatively new topic.
Neither of us felt comfortable with penicillin and amoxicillin for life.
Right. When we gave them their Colestyramine or their Colestyramine, 94% of their CIRS symptoms got better or went away. 94% of their PANS or PANDAS symptoms went away. There were 19 people that were on prophylactic medicine. We were able to take them off their prophylactic medicine.
And her kid just totally changed. Well, my brother of another mother back in town. Thank you for making time for the pod. This is Dr. Scott McMahon. For those who don't know, he is a recently private practice closed medical doctor who started as a pediatrician and became the first shoemaker certified doctor, and is one of the most published doctors on the entire planet in chronic inflammatory response syndrome and mystery illness. And today, I'd like you to enlighten the whole world about the majority of POTS, postural orthostatic tension syndrome, are based in CIRS. The majority of PANS are based in CIRS. Anything you have to say about POTS and PANS?
Thank you, Dr. Dorninger, for having me back. Wow. Postural orthopedic tachycardia syndrome and PANDAS, pediatric autoimmune neuropsychiatric disease associated with streptococcal infection.
Yes.
It should be PANDAS-y, but it's PANDAS.
Those PANDAS, yes.
PANS and PANDAS and POTS and oils. But that's Chris Kenobi.
So for those of you who don't know, Dr. McMahon in the CIRS community, chronic inflammatory response syndrome, where you can get sick off biotoxin exposures, molds, water damage building bacteria known as actinobacteria, endotoxins, cyanobacteria or algae blooms, Pfiesteria ciguatera seafood toxin, Lyme tick, co-infection, and recluse spider venom, and maybe more. We're going to Tempe, Arizona for CIRS X, June 5th to the 8th. Does scorpion venom become added to the list? We don't know. But you are the maestro who got to see predominantly pediatric patients for CIRS when you got started. Then it expanded into all ages. And one of the things you blew our mind with in 2018 is sharing a talk called, favorite talk title ever, POTS and PANS.
POTS and PANS.
POTS and PANS.
Yeah, PANS. PANS is a version of PANDAS that's much less specific. Yeah, back then, PANDAS was a relatively new topic, and started with a woman at the NIH who was studying pediatric patients who had OCD, obsessive compulsive disorder. And
she had OCD?
No, she was studying them. She was working at the NIH.
She was obsessed with
Hey, that's a nice hat. Where'd you get that?
Thank you.
Okay.
Yes.
So she was studying that, and she noted that at least 25% of these kids had infection with streptococcus and like a group A beta hemolytic strep throat.
What we call pathogenic strep, or you want to consider antibiotics for that sort
exactly.
of throat.
The strep that ate my face, if it gets out of your throat.
Yes.
That's from London.
Yes.
And so she studied that. I'm going to be serious. One of us needs to be serious. So she studied that and came up with the original criteria for PANDAS and found it in, like I said, at least 25% of these kids that were having OCD, and saw that there was this waxing and waning kind of character. So when they got a strep infection, the symptoms got worse, and they were neuropsychiatric symptoms. So, I mean, these kids were raging, for instance, on their parents. I mean, they were just normal, and then all of a sudden, they're like ballistic. Your little angel who now is, doing kind of like red rum things. And so she came up with a diagnostic criteria, and she published it. It was some people think it's controversial, but I don't. And in 2000, I think it was in 2013, there were some people from around the country who all got together in Stanford and created at that time what was the best diagnostic criteria, the Stanford criteria. And Dr. Shoemaker and Dr. Jennifer Smith, who's in the Phoenix area, and Jimmy Ryan and I took a bunch of our pediatric patients who had been previously diagnosed with PANS or PANDAS, and we evaluated them based on those strict 2013 criteria. And then we also evaluated them for CIRS at the same time. And of the 39 kids that we started with, 6 didn't meet the criteria to be called PANS or PANDAS. And so we excluded them. The other 33 all had the biomarkers that we routinely check with someone who has CIRS. And all 33 of them, 33 out of 33, had biomarkers for CIRS. I mean, is that nuts or what?
That is nuts.
So they all got treated either with Colestyramine or Colestyramine, also called Welchol. And we had just some amazing results. Now, just to set the context, back at that time, there were a whole bunch of treatment regimens for PANS or PANDAS. They included using antibiotics prophylactically. They were using IVIG. They were using cognitive behavioral therapy. They were using SSRIs. They were using a combination of cognitive behavioral therapy and SSRIs. They were using I already said IVIG. They were talking about plasmapheresis and whatnot. Not a single one of these therapies had better than 50% efficacy. Not a single one. And at that time, what we saw when we gave them their Colestyramine or their Colestyramine for a month or 2, sometimes 3, was that 94% of their CIRS symptoms got better or went away. 94% of their PANS or PANDAS symptoms went away.
Wow.
Their neurobehavioral symptoms, 75% reduction in neurobehavioral symptoms. And again, at that time, nothing even approached 50%.
No way. It's amazing.
And last but not least, there were 19 people that were on prophylactic medicine. We were able to take them off their prophylactic medicine.
Prophylactic usually meaning antibiotics.
Antibiotics.
And for those of you who don't know PANS, these kids who suffer these intrusive thoughts and this anxiety and this obsessive compulsive, the treatment, which is kind of violating to a naturopathic doctor, is to just say, good chance you're going to be lifetime amoxicillin, lifetime penicillin, or some kind of anti-strep, traditional antibiotic. Right? And a lot of those doctors are also co-prescribing Probiota, right? But we were just talking at dinner, Bill Davis, we got our 2 Bills, my Bill Blanchette, who brought the heart scanner here, and then Bill Davis, who wrote Wheat Belly, just wrote his Super Gut. And he talks about how the psyllins knock out Lactobacillus reuteri. So very, very sensitive probiota to those psyllins. And he is helping restore SIBO with Lactobacillus reuteri dairy or coconut yogurt.
Right.
And he's saying we have an epidemic from giving psyllins. And as a pediatrician, I know how to treat a otitis media, a middle ear infection with naturopathy, and I can use St. John's wort and garlic and mullein ear drops and maybe a hot onion and just some classic stuff. But my own kids got penicillin and amoxicillin for strep because it's scary, and your kid can die of rheumatic heart disease or kidney disease and get their strawberry tongue and their red streppy cheeks, right? But we kind of missed, we knock out all the Lactobacillus reuteri that can then set up GI symptoms and later problems. So neither of us felt comfortable with penicillin and amoxicillin for life. Right. So I wasn't sure how that happened. So you did Shoemaker protocol. They were on Welchol, Colestyramine while many of them were doing psyllins like amoxicillin, penicillin, and then at some point you said, let's see if we can pull these antibiotics away and avoid intrusive thoughts, obsessive compulsive, and so on and so forth. Yes. Yeah. And we had follow-up for 6 months, and of the 19 kids that we took off their antibiotics, none of them had a relapse, not a single one.
So it's pretty amazing.
Wow.
Still working on getting that published.
Yeah.
It's pretty interesting data. Also looked at Gini findings and NeuroQuant findings. Of course, NeuroQuant is the volumetric brain MRI.
Yep.
And Gini is the transcriptomic test.
Yep.
And just had some very interesting findings. The numbers on those were quite small. But we saw that basically these kids had all the findings that you'd expect to see in adults in their brains, for adults who had CIRS as a result of water-damaged buildings. And they had enlarged hippocampi, which is something in the PANDAS literature that they see on volumetric brain MRI. And our thought on this, one way, 33 out of 33 of these kids had CIRS. One way of thinking of that is maybe PANS or PANDAS is a phenotypic variant. It's like it's a variant of CIRS, but it's not the classic. It's just a variation of it, and that's possible. But I don't really think that's what it is. I think that a lot of people get strep throat. And as a result of that, they may get antigen antibody complexes and whatnot, but they can't get into the brain because of the blood-brain barrier. But we know that children and adults who have CIRS have elevated TGF-beta1, elevated MMP9, elevated C4a, decreased levels of vascular endothelial growth factor, decreased levels of VIP, and all of those impact the permeability of the blood-brain barrier. And so my thought is that maybe CIRS is a necessary condition for someone to get PANS and PANDAS.
Right. Why doesn't everyone who got strep get PANS, PANDAS? Yeah,
exactly.
It's a very fair question. Just to rewind for a second, I was jokingly going to say, why don't doctors who are seeing PANS kids screen for CIRS? And again, for those of you who don't know CIRS, it's chronic inflammatory response syndrome. It's called mold illness. It's been called seafood toxicity. It's been called Lyme long haulers. It's been called sewer gas, brain atrophy, so on and so forth. But all of these are chronic inflammatory responses. Your own immune system goes bananas to one of these biotoxin exposures. And I'll tell you why I don't screen, because you haven't published your paper yet.
Working on it.
And I remember what you said, and that's that you are looking for a high-impact journal because you would really you have good data, right? It's not 3,000 kids, but 33 kids with the amount of pre and post data you collected and the clustered symptoms. It's extraordinary. Yeah. But ideally it would get in the American Academy of Pediatrics or a family primary care journal or New England Journal of Medicine. Is there any tips or tricks that you have to get it into a journal that would have higher impact, so doctors would say, little Timmy was normal. Now he hugs onto his mom's legs with severe anxiety and climbs up a tree whenever the neighbor kid comes over and he's totally freaked out by the world. Is there any way we can ram this down standard of care's throat so that if they see PANS, they say, I'm going to do a visual contrast sensitivity. I'm going to ask 37 symptoms and then do the CIRS labs?
Yeah, if I had an answer to that, it would already be published. We did reach out to one high-impact journal, and they didn't decline it. What they said was, we don't know anybody who's an expert in PANS, PANDAS, and CIRS that they could actually peer review this. And I said, well, I know a couple people, and I sent them names, and they both were academically linked, and I think they just thought it was maybe too controversial.
Wow.
So again, they didn't deny us. It wasn't rejected. It just was, we don't have anybody. These are too new. These are too hot.
I'm embarrassed to say I doubted PANS, PANDAS about 16 years ago. And I now know my approach is to doubt nothing, to challenge everything politely. Right. So I'm just going to say, oh, that's curious, and then look into it without ignorance or arrogance, right? And my first experience with, oh my gosh, this is real, was a medical doctor family and they had come to see me, and he was this hardcore surgical guy, and she was primary care, and she was no longer practicing because she had to take care of her special needs child now.
Yeah.
And this kid socialized like a beast, and he was on the soccer team and had tons of friends. And then out of nowhere, after strep, he just hugged his mom's leg and would climb trees. And that's why I was thinking of him when I shared that. And not climb trees like, let's go climb a tree and have some fun. Like whenever he was spooked, he would climb up to the top of this tree, or he would grip on to his mom's leg.
Wow.
And she would show me pictures of him playing soccer. Like I was really like, does this really happen to your kid?
Yeah.
And her kid just totally changed, you know.
In the initial definition of PANDAS, the kids were pre-pubertal. So and they don't have to be anymore. But can you imagine, like a 9-year-old daughter, and she's just the sweetest, kindest little child, and then she gets a strep throat, and all of a sudden she's just psychotic, you know, and raging, and very selective about the food that she's going to eat, and now has tics and or maybe even seizures, and she's like that for a few days, and then the strep goes away. She might go back to normal, but she might not. Some of these kids do go back to normal, you know, after their normal behavior, but some of them don't, and they stay affected, and it's more permanent. And I mean, it's a tragic thing. But don't feel bad. I mean, you know, it's our job to question everything. And in medicine, I think it literally is our job to question everything, and to search out the peer-reviewed published literature to find out what the objective truth is. And I'll be honest, when I first heard about mold-based illness, I thought, well, they never taught me anything about this in medical school. And so I just, you know, kept an open mind. I've seen enough crazy things from therapies that in Western medicine we would consider voodoo or just totally crazy or without any kind of merit. But I've seen things that have happened to like little babies. You know, I don't think there's a big placebo effect on babies. You know, so I've seen things, so I keep an open mind. And that's what I did when I saw mold. But I wasn't sure until after I went. Well, after we evaluated 15 people and got the lab results back on 15 people and had just an unexplainable number of abnormalities. And then when we compared that with Dr. Shoemaker's data, this de-identified data, so, wow, these people have the same syndrome.
Wow.
And then we treated them. And the ones that took treatment seriously got better, and the ones that didn't, no change. And it's like, okay, I guess this is real.
So I think we keep seeing this phenomenon repeat in our world of mystery chronic illness. And I think of the COVID paper, of which 5 of those 19 patients were from our office, and I was one of our 5. And for people who don't know, COVID long haulers are potentially a CIRS, but in our 19, COVID long haulers were all CIRS.
Yes.
And unlike the original,
whereas the people who had COVID and weren't long haulers were not CIRS.
We're not CIRS, right? So, and that's where I was going is just like this strep and PANS phenomenon. Dr. Shoemaker postulated years ago, the majority of our CIRS patients are genetically susceptible. And for our listeners, 95% of CIRS patients have a predisposition of HLA, which means on chromosome 6 from mom and dad, Lady Gaga born that way, they have 1 or 2 genes that predispose them to go into chronic inflammatory responses when exposed to biotoxins.
Do you know Lady Gaga's haplotypes?
I guarantee, well, I don't guarantee you because I'm a data-driven guy, but if she doesn't have CIRS, pigs fly over the moon. She's doing those.
I totally agree.
She's doing those, and I thought her song at Super Bowl was pretty dope. And we got connections to NOLA, so that was nice. But she has the severe psoriasis, right? And anytime you have a skin issue, we say it's what the liver can't handle knocks on the door of the skin and comes out, or you're having an immune response, or we know there's some kind of topical bacteria, potentially like an actinobacteria, that's causing problems like in a seborrheic dermatitis. And that whole phenomenon with COVID made me reevaluate your PANDAS phenomenon, because you presented on that in 2018, right? So we really do need to get that published, but you presented it at a peer-reviewed conference in 2018, and I remember everyone's jaws were dropping, and everyone's thinking of little Timmy and little Sally, the patients they have in their clinic that are like, oh my gosh, I got to go back and run CIRS markers on these PANDAS kids. And for the COVID, what happened was people were in endotoxins, sewer gas, poop, caca, doo-doo, manure, or actinobacteria, or both.
Right.
And those are good for no one, but they were living relatively fine lives, maybe B+ existence on physiology. Then they got COVID. They didn't die of the COVID, but they turned on dormant genes that then produced inflammatory widgets that didn't turn off after the COVID. Right. So, but then other people got COVID, to your point, and they did not turn on MAP kinase and TGF-beta receptors. They did not turn on CD14, toll receptor 2, and toll receptor 4. The first for actino in COVID, the second for endotoxin in COVID. So we're probably, if we could get bigger numbers with genies and PANDAS, hello, donors of the world. If you want to sponsor some cool research, reach out. But we probably are seeing they have HLA, they were in exposure, then they get strep, then we give them antibiotics for the strep, but they've turned on inflammatory genes.
Right.
And to your point, matrix metalloproteinase. I'm the protein digesting inflammatory cytokine of the matrix, the blood-brain barrier. And now I had a very tight border between my bloodstream and my brain, and now it's porous like this, and now I'm neuroinflamed and having psychological phenomenon. Right. So when you...
And if I could stop there just for a second, it's been shown that if you create breaches in the blood-brain barrier, or if you increase the permeability adequately, and you have an inflammatory process going on in the rest of your body, it could be Th1, it could be Th2, or it could be Th17. Doesn't matter. But if you have an excess of cytokines and you create that breach in the blood-brain barrier, those cytokines, and if the breaches are large enough, even cells will cross into the brain and create an inflammatory process in the brain.
Okay. So, and then that's the big picture, and you have the data to prove it. But in regards to all the other things we know, right? What's a balanced immune system? I always preach the Fab Five: fat-soluble vitamins, crap seed oils out, anti-inflammatory EPA, DPA, DHA in, glutathione, probiotics, short-chain fatty acids. These have all been shown in the peer-reviewed literature to balance that Th1, Th2, Th17 immune system, right? So you were hanging out today, and we saw a D3 of 12.8.
12.8.
So what if you have a 12.8 D3, and Timmy's the best header in soccer, and waking up with microglial cells and getting some blood-brain barrier issues there, is in a moldy kindergarten and then gets strep, right? It's probably multifactorial, but what you proved was these kids have CIRS. We treat them with the only peer-reviewed, reproducible, published treatment protocol for CIRS, the Shoemaker protocol, and then we can wean them off their antibiotics and get them back to a stable, normal life.
Pretty amazing, huh?
It's when I think of that mom, and I think, darn it, I was 8 years late to knowing this, right? It is amazing, but it needs to be standard.
I was 18 years late to learn about CIRS.
Yeah,
so
fair enough.
So another thing that you brought up long COVID. In December of 2020, I was writing a chapter for a medical textbook that later got published in 22, 23. And in that, I was comparing post-sepsis syndrome, survivors of sepsis, children, adults. There's symptomology that's very similar to long COVID, which is very similar to people that have CIRS. And at the time, all I saw the difference between those was just acuity. And but I should add, I've had 2 post-sepsis kids. They were both teenagers. One survived H1N1 flu. One survived viral encephalitis. And they both were completely septic, and they both came out with post-sepsis syndrome. And 2 years later, I checked their blood. They would have qualified for CIRS based on that. So they're continuing to make elevated levels of cytokines that we see in CIRS 2 years after their event. And what would we find if we did the same research on long COVID people? Well, Dr. Shoemaker started that process, looking at the transcriptomic changes and seeing similar to people that had exposure to actinobacteria and endotoxin.
Yep.
So there you go.
That's mind-blowing. So 2 things to anchor what you just said, because that's
excuse me,
really potent, right? When you look at the peer-reviewed literature and you have patients come in and say, hey, you don't have any inflammation. Sometimes they looked at a C-reactive protein, a ferritin, a SED rate, and there's no elevations there. Well, CIRS doesn't raise C-reactive protein, ferritin. Once in a while you see a CRP go up with a Lyme because you have infection.
But only like 10%.
But
it's
meek.
known that it doesn't show up in Lyme.
And we say, hey, they looked at oak trees in the forest. Did you know that there's elder trees and 50 other cytokine trees? Right. And then we pull those. But to your point, there are 3 illnesses with profound overlapping cytokine inflammatory patterns, and that's traumatic brain injury, CIRS, chronic inflammatory response syndrome, and SIRS, systemic inflammatory response syndrome, which is like a bacterial encephalitis, which you're dealing with sometimes in the hospital when you do some of your crazy emergency pediatric stuff, right?
Yeah.
But to think that the SIRS, the systemic inflammatory response syndrome from a bacterial encephalitis, could then turn into a CIRS, because technically you're not culturing a septic bacterial infection anymore. Right? And just to think that whole overlap, and then to go back to the big point, which is what Dr. Shoemaker found is 95% of these patients are HLA or genetically predisposed. Rheumatoid arthritis patients, Caucasians with RA, are 60% HLA predisposed. So still a massive genetic predisposition, but CIRS is like, whoa. Then they got exposure. Then they had a cold or a flu.
Yeah.
And we're also looking to raise money to say, could a head injury turn the gene with the exposure into now I'm just chronically making inflammation? Could trauma, and then could 3rd trimester going into postpartum? All I can tell you is clinically I've seen all 3 of those, but you say, show me the data, and I agree. So we have to see if Ronaldo is playing a soccer match in a moldy coliseum and he's got an HLA of 11352B.
There is no mold in Saudi Arabia.
That's a good point. Yes, totally.
You have to have water.
goldenremediation.com. Yeah. Well, but could he go for that last header and turn on CIRS? We don't know, but in theory you would, right? So to land this plane of every single PANS you saw, and again, 33 is not 3,000, but 10 is where, as Dr. Shoemaker would say, 10 is where you have a curious thought. 30 is where you start saying, I could be onto something very real here, right? What is the criteria for our doctors, parents, and patients to screen a kid for CIRS that's cost-effective and easy? What's the difference between screening a kid for CIRS versus screening an adult?
That's a good question. And let me frame it slightly differently, if I might. Again, looking at post-sepsis syndrome and looking at long COVID and looking at CIRS, I see them as a continuum. I mean, post-sepsis syndrome, I call the hurricane. Mm-hmm. It's like, the hurricane came and just destroyed everything in its path. That's post-sepsis syndrome. Long COVID came, and again, it's just destruction starts occurring, I call it the tornado, because it's not as bad as post-sepsis syndrome, but it's still pretty bad. And CIRS, I call 60-mile-an-hour winds that are hitting your house 24/7, 365, just continuously hitting your house, and eventually it's going to create some damage. Eventually, it's, you're going to see some of the roof shingles are going to start flying off, or maybe some of the siding starts to creak, and then you start getting more water damage that then eventually destroys the house. So that's the way I look at that problem. So your question is, when do you start looking at it? Well, when you have multi-system illness that you don't have an answer for.
Right.
And in small children, it doesn't even have to be multi-system illness. If you have, chronic headaches, that you can't explain with, God forbid, a cancer or something like that. If you have chronic stomach issues and you've done your full workup, maybe they've even been scoped, they've had a colonoscope, I guess it's from the other direction, or you've done the esophagoscopy, and you don't have a reason, or you see some inflammation, but you don't know why it's there.
Right. It's not falling into celiac or Crohn's.
Right. It's a non-specific gastritis or a non-specific colitis is what you usually get. You should be thinking about CIRS. If you have a child that has chronic fatigue, and again, you've done your normal workup and your CRP and your SED rate and your CBC and your chemistry, and they're all normal, and you don't know what it is, rather than send that child to the psychiatrist, you should be looking for CIRS, because my data says that about 9 times out of 10, they're going to have CIRS.
Wow.
So same with the headaches, same with the stomach aches. For older people, you get to be 10, 11, or even older, we're looking at multi-system illness and you may not always see it because they don't always complain about it. They'll complain about their headaches because they go home from school, or they may complain about their stomach aches, but they may not complain about the headaches because they're only 2 or 3 times a week, and I don't go home from school because of those. And I'm fatigued. I'm not playing soccer anymore because I don't have the energy to do it. And I was getting short of breath when I was out on the soccer field, even though I'm 10 years old, I don't have asthma, and I've never been short of breath in my life until recently. So if you don't look for it, you may not see the multi-system problems. But if you're familiar with CIRS and you see that they have 1 or 2 of these problems, then you know to go look for it and then do the screening blood tests. And if they don't have it, the screening blood tests will be normal.
So, wow. When I go teach understanding CIRS, whether it's to the public or to doctors or healthcare providers, I have a section on pediatrics, and I say, out from our most experienced, you're the most experienced pediatrician and have seen the most CIRS kids in the entire globe, which is pretty wild.
That may be true.
It's true. Yeah. And I said, here's the deal from Dr. McMahon, because I know you also serve some very intense socioeconomic populations too, and you would say, if you have fatigue, headaches, and tummy pain that you can't explain with other pathophysiology, you're probably looking at CIRS. The next thing you taught me was that kids can't see the visual contrast in a trustworthy way before 7 years old. And 7 years old, you said you can entertain doing a visual contrast on survivingmold.com. We don't get royalties. That is the place where they validated that testing. And then when you ask those 37 symptoms arranged into 13 groups, if you say yes to one question in a group of 5 or a group of 3, that's a positive group or positive cluster. And for adults, if you have 8 out of 13, there's a 95% likelihood we're looking at CIRS, right? There's a 1 in 20 chance we're wrong.
I think it's higher than that. I think it's 98.85%.
When you add the failed VCS, right?
When you add the failed VCS.
Add the failed VCS. And for kids, you said it's 6 out of 13.
6 out of 13.
And your definition of a kid for that was under 11.
Under 11, yes.
Yep. Thank you for enlightening the world on PANS. Let's take a break. We'll come back and do another episode to POTS. I think even though POTS and PANS go together well in the cupboard and sometimes in the human physiology, we'll give people a break, let the steam come out of their ears, and then we'll go cook some POTS. Thanks for being here, brother.
Oh, it's my pleasure. Thank you, Eric.